ITV News has learned that the number of new and expectant mothers in England getting specialist support for mental health issues has almost doubled in the last 3 years. Data from NHS England shows that more than 57,000 women received treatment in the past year. That's up a third compared to the year before. But those working in the sector say investment in services is unstable and many women are tragically falling through the net. Our health correspondent, Rebecca Barry, has this special report.
This baby's in hospital not because she's unwell, but because her mum is in a mental health crisis. We're at Ribblemere Mother and Baby Unit in Lancashire. Around 20% of women will have mental health struggles in pregnancy or after birth. A small number will get so severely ill they need to be admitted to a psychiatric unit like this, where they can be treated with their baby.
About a month after the birth of my son, I got postpartum psychosis and I was admitted to this MBU.
Ellie spent 3 months as a patient here.
I'm looking around and there's still the beautiful cot, and that's where I used to change my son. So it is quite a moment being back here, actually.
She was one of the 1,200 mothers who experience psychosis each year in England and Wales.
You feel quite alone. It's quite an isolating experience. It's way more than depression and anxiety. It's like the end of the world. That's how it feels. My son's nearly 4. He doesn't remember being in hospital, but I'm very open about it. I think it's really important for him to know that I got better.
The pandemic and the cost of living crisis have driven a rise in all mental health problems. The increase in pregnant women and new mothers getting support is partly down to improved services, but also reflects the growing demand.
A lot of society's expectations about being the perfect mum who does everything and to enjoy it from the outset, and for lots of people that's just not the experience, and it can be very difficult to adapt to being a parent and very lonely.
We have been open since 2018.
6 years ago, this unit didn't exist, so women would have had to travel miles away or go to a general adult psychiatric ward. But across England, some women are tragically missing out.
She was just one of the world's lovely people.
Kath was excited for the birth of her first child, but Otis was born prematurely and only lived for a day, leaving Kath in crisis and a chasm of care. 7 months later, she died by suicide.
The services just weren't there to support somebody like Kath. She just slipped through the net. And as a family, we were picking up the pieces for Kath. And it's not appropriate for that to happen. There should be somewhere for bereaved families to seek help.
An inquest found failings at the hospital where she was being treated contributed to her death.
The loss of Kath is just difficult to put into words. We've almost lost the heart of the family. Even 18 months on, we fully expect her to walk through the door, and she's never going to. And I think that's a really hard thing to come to terms with. It's just devastated our family completely, the loss of Kath. We just miss her. We really miss her.
Her local NHS trust, Herefordshire and Worcestershire, says it's carried out a review to find out if it can make changes to prevent deaths in the future.
1, 2, 3, 4.
2-year-old Matilda is clearly thriving. She and her mum benefited from the perinatal mental health services here in Northamptonshire. They started 5 years ago and now help 900 women a year. Hasvi became severely unwell during her pregnancy after the loss of a previous baby.
Where do you think you would be if you hadn't had the support you got?
I don't think I would probably be here if I hadn't had the help. I haven't really thought of that. Yeah, I don't think I'd be here. Neither would my little girl, I think.
Her little girl and specialist support giving her hope again.
She's amazing. Her name Matilda actually means I've been loved. I felt love again. I felt embraced again. I felt, yay, I can do this life thing again. How fun is that?
Anyone can experience maternal mental health problems, but some are less likely to receive the care they need. Black and brown women, young mothers and those living in poverty. Experts say more needs to be done.
There's a huge demand and a huge request for this care, and services, even though they've expanded, are stretched, and sometimes they struggle to meet that demand.
Suicide remains the leading cause of death for women in the first year after birth. For the next generation, the health of their mothers couldn't be more important. Rebecca Barry, ITV News.